This is the weekly Health Law News Nugget from Southern Health Lawyers. I'm Rich Sanders.
And this is the Health Law News Nugget for the week of Monday, February 24th, 2020. Well, it's not often that we get a chance to talk about business and law together on the Health Law News Nugget and mention antitrust. But we've got antitrust law in the news this week, and so a great opportunity to talk about an area of law that doesn't often implicate the healthcare industry. Reuters reporting this week that Allergan, the pharmaceutical maker, has entered into a settlement in a class action lawsuit in federal court in Brooklyn for resolving claims under the antitrust laws that it improperly interfered with the introduction of genetic versions of its dry eye medication into the market. Antitrust laws, of course, are 150 years old and were originally, as the name implies, antitrust, were originally passed by Congress in the 1880s to interfere with trusts or monopolies that had developed in various areas of American industry, in particular steel, oil, and railroads. Well, the antitrust laws have grown over time to include not just monopolization of geographic or service markets, but anti-competitive conduct like price fixing or predatory pricing and the sharing of confidential information. Here the allegation is that somehow Allergan used its influence to interfere with the process that genetic drugs are used to be introduced into the market and ultimately receive a federal approval, and a class action was formed for a federal court action that ultimately was heard in federal court in New York. The settlement entered into by Allergan with the Department of Justice this week was for $51 million. So apparently, not only was the level of accusation pretty serious, but the number of potential plaintiffs in that class action was also pretty significant. So another opportunity for News Nugget watchers to remember that whether it's monopoly or anti-competitive conduct, the antitrust laws are there and are actively enforced by the U.S. Department of Justice, even in the healthcare industry. I'm Rich Sanders. Thanks so much for watching this week. We'll look forward to seeing you again next week on the Health Law News Nugget.